What's crack-a-lacking? My name is Oriafa, soon to be Dr. Oriafa, as I am graduating medical school tomorrow, getting my MD. And I am graduating from Howard University College of Medicine, and I am an incoming ophthalmology resident. So I thought now would be a great time as people are starting to decide on what specialties they want to do, and as I'm officially becoming a doctor, I wanted to talk about why I chose the specialty I chose, which is ophthalmology, also known as eye surgery. So I'm going to break this down into the main reasons I chose ophthalmology, as well as a few perks that maybe not have been driving factors in my specialty choice. And then I will also mention other considerations that relate to ophthalmology but didn't really have any weight for me. So I actually first found out about ophthalmology through a YouTube video. If you know about Med School Insiders, Dr. Kevin Jabal, he has this series called So You Want to Be, and I stumbled across this video called So You Want to Be an Ophthalmologist, and that is where I learned some of these initial things. One of the main things that initially drew me to ophtho was its balance between clinic and surgery. So the reason that I liked this as a concept was because I'm somebody who thrives off of relationships. That's what I really find meaning out of, building relationships with people and being able to chat, have conversations, establish trust, and really be able to make meaningful impacts on people's lives. But I didn't only want to impact people through conversation, but I also wanted to do something surgical. You know, I'm someone who enjoys doing in general. I enjoy working with my hands. I also learn best by doing. I'm a kinesthetic learner. I played a lot of instruments growing up, liked doing drawing as a kid and things like that. I loved working with my hands. I thought the concept of having somewhere where I can both work with my hands and be able to build meaningful relationships was a good idea for my personality. And this was only further established throughout my rotations. I was definitely more in love with the surgical specialties that I rotated on. I love being able to make tangible impacts, like something I physically did is having an impact on somebody for the better. And I just find it fun, to be honest. I find it fascinating. And I really do love building those skill sets of being able to suture and overall just improve my technical skills. That's something that was a confirmation. And something that's unique about ophthalmology is that it is microsurgery. So not only was I attracted to the fact that ophthalmology is a surgical subspecialty, but I also preferred the types of surgery that was being done in ophthalmology compared to some other specialties. OB-GYN, for example, I just thought C-sections were just too gross. Not gross like disgusting, but gross like big, or like with the naked eye. I was always more captured by the vascular surgeries of the world, the ophthalmologies of the world, where you're doing these very delicate, precise movements. I just found it so much more beautiful and fascinating to watch. The attention to detail required was something that I was just naturally drawn to. The second reason I chose ophthalmology was being able to have a high impact on people's qualities of life. And this is something I knew I wanted going into medical school. I was initially interested in psychiatry actually because mental health is such a big part of people's day-to-day life, how they view the world and how they perceive the world. And I really wanted to play a part in that. However, when I realized I'm a surgeon at heart, that went out the window. But I feel like ophthalmology also has something similar to that. Vision is such a humongous part of how people literally view the world, how they go about their day-to-day life. So really being able to do work, whether it's through medications or surgical procedures to help people get their lives back and be able to live their lives to the fullest, is something that I just view as extremely meaningful and is the type of impact that I want to have. And if you come to ophthalmology clinics, you'll notice that the patients are so grateful, especially those post-operative clinic visits right after a cataract surgery where at first their lens was all cloudy and they couldn't see jack squat, but now we took that old lens out and put it in a new lens, and now all of a sudden they can see 20/20, and they're just so appreciative of the gift that we've given them to be able to see again. It's really priceless, and it's not only restoring vision but also preserving vision and being able to educate patients on the things that they may not know can knock their vision out. One example would be glaucoma. Glaucoma is when you can get damage to the optic nerve, and how it usually presents is that the vision loss starts out and then slowly creeps in, very, very slowly, to the point you won't even notice it's happening. But being able to educate patients on this and identify these issues and be able to halt that process so that they can preserve the vision they have and be able to live independently and live on their own terms for as long as possible is something else that ophthalmologists get to be a part of. My third reason for wanting to go into ophthalmology is that the eye actually has so many interactions with the rest of the body. For example, it is possible for an ophthalmologist to look into your eye and say, yeah, I'm about 99% sure you have diabetes, even if they weren't previously diagnosed, because diabetic retinopathy is one disease that's obviously common in diabetics, and it can affect the blood flow within their retina, which is at the back of the eye. I love learning about the different systemic interactions that are involved in ophthalmology, different syndromes that can have ophthalmic manifestations. I think the eye is one of the coolest little ecosystems in the body, and just the way that the physiology works and how the physiology affects the pathology and how the medications affect the physiology to reverse the pathology. I don't know, something about it is just very intriguing to me, and I genuinely always love learning about ophthalmology. Even different inflammatory diseases, autoimmune diseases, those can have manifestations in the eye as well. Neurologic diseases can have manifestations in the eye. So I just think there's so many moving parts to it, both within the eye and outside of the eye itself, and there's just so much to learn about it, and I genuinely enjoy it. My fourth reason for choosing ophthalmology is that the people are actually happy for the most part, the attendings in particular. For a surgical subspecialty, I think ophthalmology is one of the nicer ones. Most of the people I've met are very genuine. The residents I've met have been kind. The attendings I met have been kind. Of course, there are a couple bad apples, but in the grand scheme of things, it's a very collaborative environment, and I haven't had anybody discourage me from going into ophthalmology, and I know a lot of other specialties can't say the same. And kind of tying into that is my fifth reason for choosing ophthalmology, which is the work-life balance. So ophthalmology is one of the ROAD specialties, which is an acronym. That's radiology, ophthalmology, anesthesiology, and dermatology. So these are the specialties that have a pretty decent lifestyle, regular hours, but also balance that with having a good pay. And in as much as I think that acronym is a little bit outdated, I would still say it's true for ophthalmology. Although ophthalmologists do have emergencies and do have call, outside of that, you're typically working in 8 a.m. to 5 p.m. schedule, and you're able to go home after that. It's a bit more demanding as a resident, and I'm okay with that, but I just want something where long-term I'm able to pursue my other interests and also have time to spend with my future family, and that's actually something that was very, very important to me, just considering what I value the most. My sixth reason for choosing ophthalmology is that I am interested in global health, and I think ophthalmology is one of the best specialties when it comes to global health opportunities. And I say this because you can go to a certain country, even if you can't stay there for years at a time, you can even go there for a week and have such a huge impact on tens to hundreds of people's lives. For example, my family's country, Nigeria, has about 220 something million people, and the entire country has 700 ophthalmologists, which is not enough. And it really affects those people in those rural areas as well. There's just so much lack of access to care worldwide, and even in the US as well. You can literally go as an ophthalmologist for a week, do cataract surgery on a whole lot of people, and change their entire life trajectory. As long as you can find a way to mediate the post-operative follow-up, ophthalmology is great for these missions trips, which is something that I want to incorporate into my career for sure. My last key reason for choosing ophthalmology was to address some of the disparities within the specialty. A lot of the diseases that ophthalmologists deal with primarily, or not primarily, but very highly affect people of color. Glaucoma is a huge example. People of African descent are at much higher risk of developing glaucoma. And like I said, glaucoma is one of those diseases that creeps up on you. So really being able to be someone from the community to educate patients on this and help them to prevent vision loss, and really be able to walk with them on the journey is something that I want to do. Being able to serve marginalized communities is a large part of the reason I got into medicine in the first place. And I think ophthalmology has a lot of need for this. So that's another thing that influenced my decision. However, I of course am happy to work with patients of all walks of life, and being able to bless as many people as possible through whatever work I do in the future. So those are the main reasons I chose ophthalmology. I also wanted to mention, if you did not know already, ophthalmology is a very competitive specialty to get into. So it requires a lot of grit, dedication, and focus to be able to do what it takes to match into ophthalmology. And even just to get through medical school period is a marathon, not a sprint. And one thing that helped me throughout my journey with improving my focus has been Magic Mind. This is what the bottle looks like. Magic Mind is a mental performance shot. So unlike caffeine, which will make you jittery and you can end up crashing by the end of a couple hours, Magic Mind actually does not make you jittery, but it gives you a calm energy. It has ingredients that, while improving your energy, help to actually reduce stress while improving your focus. That way you can actually get really in the zone and almost into a flow state when you study or work. I've used Magic Mind for about 3 years now throughout medical school. I even use it when I'm editing YouTube videos, and it really helped me to focus when I was trying to learn an overwhelming amount of information. I usually like to drink Magic Mind by itself as a shot, but you can also drink it with your caffeine. And if you were to do that, it actually extends how long your energy lasts, because it has this ingredient called L-theanine, which helps the caffeine effects to last for longer. So if you're interested in trying it, click the link in my description and you can use the code for up to 20% off of a one-time purchase and up to 48% off of a subscription. And I highly recommend you guys actually get the subscription. It's very, very convenient. They'll ship the package right to your door, and it usually comes in a pack of either 15 or 30. So that's taking it either daily or every other day. If you try Magic Mind out and you don't like it, they have a 100% money back guarantee. So there's no harm in trying it out, especially if it's something that's going to help you to improve your performance and your productivity. So once again, check them out, link in description. So now I'm going to talk a little bit about the perks of ophthalmology, things that maybe didn't drive my decision but are nice. First thing is that the surgeries are short and sweet. Cataract surgeries take about 15 minutes to do. For the newer people, it takes about 30 minutes to do. Like for the residents, I know people who can do it in 10 minutes, which is definitely better than those 8-hour long surgeries that some specialties do. The longest ophthalmology surgery you'll find is maybe 2.5 hours long, like it is very complicated. So that's something I like. Another perk is that the surgeries are also sitting down. If you didn't know, ophthalmologists actually control the microscope with their feet. Like I mentioned, ophthalmology is microsurgery. So they sit down, look into a microscope, and they actually can move the microscope around using these foot pedals, which is something I don't think a lot of people know. So yeah, you don't have to find yourself in a situation where you're standing up for 12 hours. I'll take that. However, I will say posture is important in ophthalmology, so that way you can avoid back pain. The next perk of ophthalmology is that there is very little rounding. If you're not familiar with what rounding is, so you pre-round, which is like looking at the patient's information and going to see the patient and seeing how they're doing now, and then you come back and you present this information to the big team of doctors with the residents attending, so on and so forth. And then you might walk around to every single patient on the list's room again and checking in on how they're doing. So this isn't just your patients, but also all of the team's patients. I guess that's a simplification of what rounds is. This process can take like 3-4 hours, but it does depending on the attending. And it is good that they're thorough. However, I would not say I find it enjoyable. I can do it, and I will do it. I think I generally like the overall workflow of ophthalmology because it's more so outpatient work. You look at a patient's chart, you see the patient, you type the note. You look at the next patient's chart, you see the patient, you type the note. It's not like as much of a long, outstretched process. I just like the workflow more as far as attention span goes. The last perk of ophthalmology is that there are a lot of gadgets and there's a lot of tech. It almost makes the clinic a bit more fun. Probably the main thing that ophthalmologists use on the day-to-day is a slit lamp, which is essentially a microscope that helps you to get a detailed view of the eye. There are different gadgets that you can use to see the retina, like the back of your eye. You can use lenses to look at the back of the eye through the slit lamp. The optic nerve is actually the only nerve in the body you can actually like look at directly, which is pretty cool. And ophthalmology is a very innovative field. People are always coming out with different surgical devices and so on and so forth. I just found the work that they do to be enjoyable and fun, even in the clinic setting, and being able to master certain skills to be able to get a very detailed and accurate exam. It's really fun to refine those skill sets and be able to work with different technologies. And I feel like because ophthalmology is so innovative, it's a specialty I'll probably never get bored in. And if you're somebody who's super into tech, that could be something that could make you consider ophthalmology as a specialty. And my final category is other considerations, which are things that ophthalmology has but didn't necessarily sway me one way or the other. So the first consideration would be the patient population. In the grand scheme of things, most ophthalmology patients are on the older side, so like middle-aged and elderly, just because that's who a lot of the pathologies impact the most. But you definitely do see younger patients as well. Pediatric ophthalmology is its whole own subspecialty. You can also see young adults, people who have like autoimmune diseases that affect the eye, trauma to the eye. It's usually young adults and adolescents who come in with eye trauma, as far as what I've seen. So you do get to see a lot of patient types. However, in the clinic setting, for the majority of the bread and butter, it's elderly patients. So if that's a patient population you're interested in working with, great. I personally don't really have much of a preference as far as the age of the patients I see. And the other ophthalmology consideration is that there is a diversity in the subspecialties you can do for fellowship. A lot of people don't know this, but even though ophthalmology is a subspecialty, it has its own subspecialties. This includes glaucoma, retina, cornea, comprehensive ophthalmology, which is kind of doing everything, but they more so deal with like cataracts, diabetic retinopathy, and like some of the main common diseases. Neuro-ophthalmology, oculoplastics, uveitis, ocular oncology, ocular pathology. Did I say pediatrics? And strabismus? I might be missing some, but I'm just trying to show you that there are a lot of ophthalmic subspecialties to choose from. So if you feel like you don't like a certain thing, you can just do something else and focus on the thing you like. Personally, I have some level of interest in all of these subspecialties at this time. I don't know if I want to do a fellowship. If I do, I don't know which fellowship I want to do. So that's something I'm going to continue to explore. All I know is that I love ophthalmology in general. I hope you enjoyed this video, and I really hope it was informative, and I hope you learned a bit about why I went into the best specialty in medicine, and I hope I inspired some of you to also consider ophthalmology as a subspecialty. It truly is a hidden gem, and I am very excited to move to New York to learn more about it. If you enjoyed this video, give it a thumbs up, drop a comment down below, and do not forget to check out Magic Mind, link in description. Adios!